Imagine yourself in the frontier of scientific discovery, working late nights in a laboratory illuminated by the hum of machines and the hopeful chatter of your brilliant peers. Every day, you and your colleagues push the boundaries of medical knowledge, striving to find cures for diseases that have eluded humanity for generations. The air is thick with purpose. Then, almost overnight, you arrive to find that 1 in every 5 colleagues has vanished. The laughter and heated debates that once filled the hallways have faded, replaced by a chilling silence and the gnawing anxiety. Could I be next? This is not a scene from a dystopian novel. It is the stark new reality facing the global biotech sector. Only a few years ago, biotechnology was considered almost recession-proof, a beacon of hope, innovation, and economic resilience. Investor cash flooded into the industry, and governments everywhere championed biotech as humanity's best chance to defeat pandemics and chronic illnesses alike. Today, however, the narrative has flipped. Layoffs are sweeping the industry, research projects are being paused or canceled, and the very heart of innovation is under threat. So what precipitated this rapid descent from biotech euphoria to existential crisis? What does this upheaval mean for jobs, scientific progress, and the vital medicines of the future? Let's journey back just a few years. In the early years of the third decade of the 21st century, biotech was enjoying an unprecedented golden era. Venture capitalists and public markets smashed previous records, pouring tens of billions of dollars into the sector. The COVID-19 pandemic acted as rocket fuel for this expansion. Governments and philanthropists worldwide invested at levels never before seen, fast-tracking vaccine research, diagnostics, and treatments. Biotech hubs like Boston, San Diego, and San Francisco were so overwhelmed with demand that startups competed fiercely, sometimes bidding double the market rate just for a slice of laboratory space. Even software engineers and former tech workers, lured by the promise of impact and stability, retrained for roles in this booming sector. But as the saying goes, the bigger the boom, the more dramatic the bust. In a stunning reversal, the last year has seen the sector's fortunes plummet. European biotech financing, for instance, has plummeted by nearly 2/3 when compared to the previous 12 months. In the United States, the situation is equally grim. ADC Therapeutics, once the toast of the industry, made headlines by laying off nearly 1/3 of its workforce. Vertex Pharmaceuticals, a stalwart of the field, parted ways with more than 125 employees. In the Bay Area, a region previously synonymous with innovation and laboratory shortages, approximately 1/4 of all laboratory spaces now stand empty, a silent testament to the industry's reversal of fortune. Biotech's seemingly unstoppable momentum has stalled, and some fear it has begun rolling backwards. But it is not just the private sector pulling back. Jefferies analysts point to government policies that have rattled the industry's foundations. Volatile federal funding, unpredictable regulatory changes, and staff cuts at key agencies have all contributed to a climate of deep uncertainty. In Washington, political gridlock and shifting healthcare budgets have frozen many initiatives that biotech companies rely on. Academic partnerships, once a steady pipeline of new talent and ideas, are feeling the squeeze too, as universities grapple with their own resource constraints and pandemic-related fallout. The upshot is painful. Companies are being forced to make gut-wrenching choices, slashing research budgets, letting go of staff, and in some cases, shutting their doors entirely. The human toll is staggering. Consider Recursion, once widely admired for its cutting-edge blend of artificial intelligence and drug discovery. In a move emblematic of the sector's struggles, Recursion's leadership made the agonizing decision to lay off 1 in every 5 employees. The ripple effects are felt throughout the industry. Across biotech, entire teams are being disbanded, promising research initiatives abandoned, and scientists, some at the very peak of their careers, are forced to scramble for new opportunities or even leave the field altogether. The result is a pervasive sense of anxiety and soul-searching. Is the golden age of biotech already over? Yet, as with any complex story, the headlines only scratch the surface. While Fitch Ratings, a major credit agency, maintains a so-called neutral outlook on biotech, insiders know the reality is far more volatile. The industry faces a series of overlapping existential threats. For large pharmaceutical companies, the looming patent cliff is particularly daunting. This refers to the expiration of patents on blockbuster drugs, which opens the floodgates for cheaper generic versions and threatens to wipe billions from company revenues almost overnight. Meanwhile, both political and public support for biotech is faltering. Just as new threats, pandemics, cancers, and neurodegenerative diseases emerge on the horizon, the resources needed to fight back are under unprecedented strain. This brings us to a crossroads. The decisions made over the next few years will not only shape the fate of individual companies, but may determine the trajectory of medicine for an entire generation. Will biotech adapt and evolve, or are we witnessing the start of a lost era for innovation? Looking forward, many industry experts are forecasting a tidal wave of mergers and acquisitions, known as M&A. Evaluate, a leading analyst firm, predicts that the convergence of shrinking funding and the patent cliff will trigger a spree of consolidation. Imagine smaller biotech startups, unable to sustain themselves, being snapped up by larger pharmaceutical giants. In some scenarios, these acquirers could be international players from Asia or the Middle East, eager to capitalize on Western distress. Scott Kersner, a respected commentator, warns that Boston's long-standing dominance as a biotech hub could be eroded as local firms struggle to survive and university partnerships unravel under financial pressure. We are already seeing the first signs of this transformation. In the Bay Area, nearly 1 in every 4 laboratory spaces now sits idle, a dramatic shift from the days of chronic shortages. Startups, once obsessed with moonshot discoveries, are now focused on survival, cutting costs, shrinking staff, and seeking out partnerships that would have been unthinkable only a few years ago. Some are merging with former rivals, while others are selling promising intellectual property to the highest bidder, even at the cost of losing control over their own inventions. Yet, it is important not to paint an entirely bleak picture. There are rays of hope piercing through the storm clouds. According to industry forecasts, biopharmaceutical research and development spending is projected to rise by about 11% in the coming year. At first glance, this may seem paradoxical, given the wave of layoffs and funding cuts. But it signals a strategic recalibration. Companies are doubling down on their most promising projects, focusing resources on platforms and technologies with the greatest potential for transformative impact. Those who weather this downturn could emerge leaner, nimbler, and better prepared to harness the next generation of technological breakthroughs. Artificial intelligence and machine learning, in particular, are poised to revolutionize the process of drug development. Imagine a future where teams of scientists can use algorithms to sift through millions of chemical compounds in a matter of hours, identifying new drug candidates that might have taken years or even decades to discover through traditional methods. Already, firms like In Silico Medicine and Exscientia are leveraging advanced AI to accelerate drug discovery, dramatically reducing both costs and timelines. The implications are profound. New treatments for rare or complex diseases could reach patients far more quickly, potentially saving countless lives. But this technological leap carries risks as well. If Western biotech firms lose their innovative edge, ambitious markets in Asia and beyond stand ready to seize the opportunity. Nowhere is this more evident than in China, which is rapidly scaling up its biotech sector. In cities like Shanghai and Shenzhen, gleaming new laboratories and biotech incubators are springing up almost overnight, fueled by robust government investment and a new generation of entrepreneurial scientists. The Chinese government has declared biotechnology a national priority, channeling vast sums into genomics, synthetic biology, and advanced manufacturing. In just a few years, China has become a magnet for global talent and capital that once would have flowed exclusively to the West. The global implications cannot be overstated. The next blockbuster therapy or revolutionary vaccine may very well be developed not in the traditional powerhouses of Cambridge, Massachusetts, or South San Francisco, but in a cutting-edge laboratory in Beijing or Guangzhou. Already, Chinese biotech firms are filing more patents annually than many of their Western counterparts. Multinational pharmaceutical companies have taken notice, setting up joint ventures and research hubs across Asia in an effort to tap into this wave of innovation. For Western policymakers and investors, this is both a warning and an invitation. Adapt quickly, or risk seeing the center of gravity in healthcare shift decisively eastward. For investors, this is a moment of both peril and promise. The uncertainty created by shifting policies and shrinking federal support has already dented market confidence. Jefferies analysts caution that, unless governments act decisively, streamlining regulatory hurdles, renewing investment in basic science, and crafting incentives for innovation, the exodus of talent, capital, and research may accelerate. Such a migration would not only hamper economic growth in established markets, but also threaten the availability of cutting-edge treatments for patients around the globe. So, what does all of this mean for you? If you work in science, technology, or healthcare, the time to pay attention is now. The movement of funding and talent signals where the next big opportunities and risks will arise. Watch for signs of industry consolidation, mergers, acquisitions, and new alliances. Look closely at companies that are not just talking about artificial intelligence and automation, but making them central to their operations. These are the organizations best positioned to survive and thrive as the industry transforms. If you are an investor, remember that periods of economic upheaval can act as crucibles for innovation. The aftermath of the dot-com collapse, for example, saw the rise of enduring giants like Google and Amazon. In biotech, today's turbulence could create a new cohort of leaders, firms that are leaner, more disciplined, and more willing to bet boldly on unproven technologies. But it could also spell disaster for those who cling to outdated models or hesitate to adapt. And for everyone else, it is crucial to understand that the vitality of the biotech sector has direct and profound consequences for global health. The speed with which new drugs reach the market, the affordability of breakthrough therapies, and our collective ability to respond to future pandemics all hinge on the health of this ecosystem. When companies are forced to downsize research or lay off scientists, it is not just shareholders who suffer, it is patients, families, and entire communities around the world. There are essential lessons here about resilience and adaptability. Michelle Hoffman's words reverberate through the sector. The fear is palpable, budgets are tight, and yet, out of these challenges, the most creative solutions could emerge. The survivors of this downturn will be those that embrace collaboration, invest in emerging technologies, and stay laser-focused on their mission. This is not the first storm biotech has weathered. In the early 2000s, the collapse of the Human Genome Project bubble forced the industry to reinvent itself. During the Great Recession, many firms pivoted to new therapeutic areas or forged partnerships with academia and government. Each time, those who endured found new ways to innovate and drive progress. Can Western biotech weather this storm and thrive again? The answer is nuanced but not hopeless. History is full of examples where adversity has fueled radical innovation. Some insiders believe today's hardship could lay the foundation for a new era, one where artificial intelligence, global collaboration, and scientific audacity converge to solve humanity's toughest medical mysteries. Picture a future where illnesses once deemed incurable are finally conquered, with cures born from the crucible of today's challenges. Getting there will require visionary leadership, smart public policy, and a willingness to take risks. Governments must modernize regulatory systems, fund early-stage research, and invest in STEM education to cultivate the next generation of innovators. Companies must embrace digital transformation, foster interdisciplinary teamwork, and stay open to calculated risk-taking. Investors, meanwhile, should look beyond the turbulence of the moment and back those willing to disrupt the status quo. For those wanting to stay ahead of the curve, keep a close eye on where the money flows. Policy changes, at home and abroad, can shift the landscape overnight. Follow the scientists, entrepreneurs, and organizations making bold bets on new technology. The decisions and innovations of the next few years will shape the health and well-being of billions for decades to come. To truly understand what is at stake, consider this. A robust biotech sector does not just mean new medicines. It means hope for families facing devastating diagnoses. It means economic growth, better jobs, and a chance for nations to lead in the industries of tomorrow. Whether you are a researcher, an investor, a policymaker, or simply a concerned citizen, your engagement now could help shape the next chapter of medical history. So if you found this deep dive informative, don't forget to like and subscribe for more explorations at the intersection of global economics and technology. What do you see as the future of biotech? Share your thoughts in the comments, your ideas.